Hi, I'm Tonya Caruso. Welcome to Comcast Newsmakers, working to reduce the rate of infant mortality. Joining us in our studios this half hour is Peggy O'Malley. She is a board member for Healthy Start, and we thank you so much for coming in and talking with us today.
Thank you.
Such an important organization, and let's begin by telling folks how you came about.
Well, Pittsburgh Allegheny County Healthy Start was launched in 1991. It was one of the 15 original sites that was provided funding through the Department of Human Services, the Bureau of Maternal and Child Health.
And what were we seeing in the region right now at that time?
We had a high infant mortality rate, particularly in the city and among African Americans. So the goal of the project really was to reduce the infant mortality rate, the number of babies dying in our community. And they wanted innovative strategies implemented, and they wanted it done, and that's what we have done really with our consortium. It's a community-based consortium, and it's comprised of community leaders.
And so when we look at the issues, what tend to be the causes of infant mortality?
If you look at our local data as well as the national data, there's a number of main causes of infant mortality. Probably the biggest one is that our babies are being born too soon and of low birth weight. And what we want to do is try to get the babies born as close to full term as possible, which is about 40 weeks, and of a good birth weight, which is somewhere between 6 and 9 pounds. What we're seeing is babies being born before 37 weeks and also being born at 5.5 pounds and less.
And so how does Healthy Start go about doing this? What sort of community programs and interventions and advocacy is taking place?
Healthy Start has a team of paraprofessionals and professionals that will visit the women and their families in their homes. And right now, actually, according to our local data with Healthy Start participants, 9 out of 10 of the women that are enrolled, they will deliver a baby of normal weight and also a full gestation. And it's really a tribute of their efforts in providing support and guidance to the families.
That's incredible. When you look at the situation, are there still strides to be made?
Yes, we're still continually trying to get the community on board with providing consistent repetitive message on different issues related to infant mortality. For example, we have experienced a lot of infant sleep-related deaths this past year in Allegheny County. We had 20 of babies that died due to SIDS and other infant sleep-related issues. We want that message out to be consistent and repetitive, that all babies should be put on their back to sleep, alone in a safe crib, with nothing but the baby in the crib. And again, Healthy Start babies, if you look at our local data, 98% of the babies that are Healthy Start participants are being placed in such a safe sleep environment.
And clearly we know how this would impact the mother's family. How does this impact our entire community? Why is this something that all of Allegheny County and all of the region should care about?
Well, if you, again, look at the national data and even worldwide, they'll say if you have a high infant mortality, it's really a check on what's going on in your community. It's a determinant of what other ills are going on in the community, whether it's diseases and illnesses, but also lack of economic development. So that's why we really need to make sure that every baby is given a Healthy Start. And one way the families can do that is by enrolling their mothers, the mothers-to-be, into the Healthy Start program.
And what do you want to say to the community about why we should take up this cause? Are you encouraging folks to get involved?
Yes, especially with the consortium from the community. They can call the Healthy Start helpline and they can ask about becoming a member of the consortium, because the consortium really guides the program. They're an advisory role and they're also a liaison with the community. And because Healthy Start really believes that the community, through the consortium, are the ones that should design as well as implement the services for the families, so that the families in their community are served best by its own leaders.
Well, we thank you so much for coming in and spending some time with us today. We appreciate it.
Thank you very much.
You're welcome. I'm Tonya Caruso. Thanks for watching Comcast Newsmakers. We'll send you back now to HLN.